Harnessing Type 2, innate lymphoid cells for cancer treatment, past, present, and future. What if a lesser-known group of immune cells could be the key to defeating cancer? Type 2 innate lymphoid cells, or ILC2s, are emerging as powerful players in immunotherapy. In today's video, we'll explore their fascinating history, current research, and future potential in cancer treatment. Segment 1. Introduction to innate lymphoid cells and ILC2s. The immune system is a complex network of cells working together to protect the body from infections and diseases. Among these, innate lymphoid cells, or ILCs, play a critical role in immunity and tissue homeostasis. What are innate lymphoid cells, ILCs? A family of immune cells that lack antigen-specific receptors but produce cytokines similar to T cells. Divided into three groups, ILC1s promote type 1 immunity, antiviral and anti-tumor. ILC2s mediate type 2 immunity, allergy and tissue repair. ILC3s support gut immunity and inflammation. Focus on ILC2s. ILC2s are tissue-resident cells found in the lungs, skin, gut, and adipose tissue. Key cytokines IL-5, IL-9, and IL-13 regulate immune responses, tissue repair, and inflammation. While ILC2s are best known for their role in allergies and asthma, recent studies reveal their potential in cancer treatment. Segment 2. The role of ILC2s in cancer. ILC2s play a dual role in cancer. Depending on the context, they can either suppress tumor growth or support it. Let's break this down. ILC2s as anti-tumor agents. ILC2s can promote immune surveillance by recruiting and activating eosinophils and CD8+ T cells. Cytokines like IL-5 help mobilize eosinophils, which can attack tumor cells. IL-13 can activate dendritic cells, enhancing T-cell responses against tumors. ILC2s in tumor promotion. In some cancers, ILC2s can contribute to immune suppression by recruiting regulatory T cells, TREGs. Tumors can hijack ILC2-produced cytokines, such as IL-13, to promote a more immunosuppressive environment. Balance of ILC2 functions. The effect of ILC2s depends on the tumor type, microenvironment, and interactions with other immune cells. This duality makes ILC2s a fascinating yet complex target for cancer therapy. Segment 3. Historical insights. The discovery and early research on ILC2s. ILC2s were first identified in 2010, marking a breakthrough in immunology. Let's trace their journey from discovery to their current status in cancer research. Discovery of ILC2s, identified in mice during studies of type 2 immunity. Named for their production of type 2 cytokines, IL-5, IL-13. Early focus on allergies and asthma. Initial research highlighted their role in allergic inflammation and tissue repair. Shift toward cancer research. Studies in the late 2010s began exploring ILC2s in the tumor microenvironment. Key finding: ILC2s influence both tumor progression and immune responses. Segment 4. Current applications of ILC2s in cancer therapy. Today, ILC2s are a promising target in cancer immunotherapy. Researchers are uncovering innovative ways to harness their anti-tumor potential while minimizing their tumor-promoting effects. Enhancing ILC2-mediated anti-tumor responses. IL-33. Stimulation. IL-33, a cytokine that activates ILC2s, is being tested in preclinical models to boost their anti-tumor activity. Checkpoint blockade. Combining ILC2 activation with immune checkpoint inhibitors like PD-1, PD-L1 blockers to enhance T-cell responses. Reprogramming ILC2s in the tumor microenvironment. Modifying ILC2s to reduce their recruitment of immunosuppressive TREGs. blocking tumor-induced signals that skew ILC2s toward pro-tumorigenic phenotypes. Cell therapy approaches. Engineering ILC2s in vitro to enhance their anti-tumor properties before infusing them into patients. Potential use in combination with CAR T cells or other immunotherapies. Segment 5. Challenges and limitations of targeting ILC2s. Despite their promise, targeting ILC2s in cancer therapy comes with challenges. Complexity of ILC2 functions. Dual roles in cancer make it difficult to predict outcomes. The same cytokines can have opposite effects depending on the tumor type and microenvironment. Tumor heterogeneity. Different tumors interact with ILC2s in distinct ways, complicating therapeutic approaches. Side effects. Activating ILC2s may inadvertently worsen allergies or other inflammatory conditions. Lack of clinical trials. Most ILC2 targeted therapies are still in preclinical stages, with limited data from human studies. Segment 6. Future directions for ILC2s in cancer treatment. The future of harnessing ILC2s for cancer therapy is bright, with innovative strategies on the horizon. ILC2 targeted drugs. Development of drugs that selectively boost anti-tumor functions while minimizing pro-tumor effects. Single-cell sequencing and biomarkers. Using advanced technologies to map ILC2 behavior in different cancers and identify biomarkers for patient selection. Combining ILC2 therapies with existing treatments. Integrating ILC2-based approaches with chemotherapy, radiotherapy, and checkpoint inhibitors. Personalized medicine. Tailoring ILC2-based treatments to the specific immune profiles of individual patients. With continued research, ILC2s could become a cornerstone of personalized cancer therapy. Conclusion. The potential of ILC2s in cancer therapy. Type 2 innate lymphoid cells may not be the most famous players in the immune system, but their potential in cancer therapy is undeniable. By harnessing their unique abilities, we could unlock new strategies to fight cancer and improve outcomes for patients worldwide. If you enjoyed this video, don't forget to like, subscribe, and share it. Leave a comment with your thoughts about ILC2s and stay tuned for more in-depth explorations of cutting-edge cancer therapies.